Welcome to Strong and Supported Pelvic Health. This is where we are going to talk all things pelvic floor, pregnancy, postpartum, fitness, weightlifting, and even overcoming pain, because you deserve to feel strong and supported no matter what season you're in. I want you to walk away from every episode with a few nuggets of applicable wisdom, feeling more empowered in your wellness journey. Let's get started. Welcome to Strong and Supported Pelvic Health. I'm here with Olivia, who is a chiropractor, but doing things differently. And in my opinion, she's doing it better. So Olivia, I'd like for you to just explain who you are, what you do, and we'll go from there.
Olivia, I'm a chiropractor. I spent the past couple of years working primarily in the pregnancy, postpartum space, as well as supporting moms in their postpartum journey, whether that's recovery from labor and delivery, and also through their feeding journey with moms and babies. So my goal with care is very similar to a lot of physical therapists, to keep people moving and build strength. So that's a little bit about how I do things.
I think that's great because one, it identifies that movement's important. And sometimes I feel like people go to the chiropractor reliant on the chiropractor to like fix with hands-on adjustments, and they're like, I have to go to the chiropractor because they put everything back in line and then I can function properly.
Yes, that is definitely a narrative that is pushed by a lot of chiropractors. I do find myself sometimes slipping into that just because it's so prevalent, but then I'm always like, hang on, that's not how this works. The goal is like for me to be a part of your team and guide you to feeling good, moving better, and building strength, and then educating you on how to move your body, essentially. So you don't have to rely on someone else to help you get better. Because at the end of the day, what I'm doing is just a tool. It's not like the actual fix. The fix comes from the patient putting in the hard work.
Yeah. And it's a really hard sell when you're like, oh, by the way, this is going to take work.
Yeah, it is. It's so hard.
Yeah. So that has its own challenges, and I deal with that as well. You know, like are there any specific ways that you help educate those individuals on how to like do the work? Because not only are they doing the work themselves, but then now they have mom and baby kind of package that you work with.
Yeah, honestly, it's still a learning experience for me because I'm finding like one thing works for one person, and then I'm like, cool, I can try this, and then it doesn't work for the next. So I'm finding it's just a lot of like education on what's happening in their body, the why that it's happening, and the process that it looks like to get to where they want to be, and that it's okay if we have like ups and downs. Things aren't going to be linear. It's okay if things start not feeling 100% awesome while we're working on it, because we're reminding our body like this is how we're supposed to move, and building that. So educating them on that, educating them on the different sensations that they're going to feel, and that pain doesn't always mean that we are injured or injuring tissue. It just means that like that's an alert, and we want to kind of identify what's happening, not stop things completely. So I found with like particularly the pregnant and postpartum populations, they have mom brain, they have hormones that are going crazy, lots of other things that are going on. So they don't always remember. So just consistently like reminding and telling them like, it's okay to feel this way. This is how we're going to get through it, and providing that support for them.
Yeah, that setting the expectations, I think, in a very kind way, to be like, yes, it's a lot of work, but I'm there to support you along the way. And I know full well what it's like, you know, the mom brain you mentioned, where you need somebody to kind of guide you a little bit step by step, even though I have to, at the end of the day, be doing the work. It is so nice to have somebody help with that. And then having those expectations, because there's a lot of, I don't know what's normal, what I'm supposed to be feeling. Is this to be expected? And then you just kind of like deal with it, because you're like, well, everyone says pregnancy and postpartum's hard. I guess this is just the hard they're talking about. And maybe it's something that could be helped, and maybe it is something that's to be expected. So that's good to be there at that like ground level with them. Yeah. You mentioned earlier that you want to really be part of the team. So I know you and I, we've talked before, and we both love collaborative care and how we want to build like this network of trusted providers that we feel resonate well with us and like our philosophies of treatment. Um, how are you doing that in the area? What are some things that really drive you to build that network?
So I particularly enjoy supporting women in the like quote unquote late stages of pregnancy. So labor prep and then into that early postpartum is where I'm like, this is my favorite place to work. So I really enjoy getting to know people who are heavily involved in that. So think like the midwives, doulas, lactation consultants, childbirth educators. To kind of get in with them and interact with them to create that network so that way they can be like, if you're experiencing this, this is who you want to interact with. And then I also like continued care. I can manage most things in my scope of practice, but just because I can do that doesn't mean I'm confident in it. So then I like to have other people, once they get past that like fourth trimester, especially when we're having pelvic floor issues, to refer out and to do the more in-depth things. So think pelvic floor therapy, mental health that plays a role in all stages of pregnancy and postpartum, and then also like fitness trainers, like personal trainers. So I have the ability to train you and create a program, but like that's not really my full jam. So I'd rather get you like moving well, re-educate those movement patterns and build your confidence with that, and then help you find the provider or trainer that works best for you to continue addressing those like deeper issues. So like incontinence, building more strength, training for a marathon, or whatever they decide works for them.
Yeah, I love that because I understand that completely where it's like, hey, like you mentioned, really liking that late pregnancy, birth prep, or trimester kind of early postpartum time frame. I don't really like that. I don't like doing that myself, that time frame, helping people through that. So same sort of thing. Like I would much rather have somebody like you who can be there. You're more experienced with that. You know a lot of the doulas, the midwives, and you can like work really closely with them. And then on my side of things, like I'm going around to different gyms trying to capture people maybe a little bit later postpartum or even early pregnancy. So like if I catch somebody from the gym moving into early pregnancy and then I get to them to a point where I'm like, cool, well, I don't want to do birth prep with you. And then I could send them to you. But that's very helpful to build those like relationships and that foundation that we're all here as a team. We really want people to get better. And I have no qualms about being like, I got the one for you.
Right. I'm the same way. I also really like the collaboration because even though like we work in the same realm of patient demographics, I can still learn and utilize some of the things that you use with your patients and bring that into my patients. So like cueing or ideas or the way that you explain things. I'm like, oh, I never thought of it that way. So that just helps me be a better provider and then also make a better referral. I think that's a huge piece in the medical system is being not only a good provider, but knowing when to refer and how to make a good referral.
Yeah, definitely. And I think instead of being like, I'm the one and only provider for all, like
Yeah.
one, no, we're not.
No.
We cannot work in isolation and give the level of care, same level of care for everybody at all stages of life. Like
Mhm.
I myself am not well equipped for maybe some of the things that other people would be. And I think we just need to communicate and get over ourselves a little bit.
The ego is hard. I think it's natural in the fields that we're in. Like we want to help and we want to like have that ego of helping people and me getting the person feeling better. But selfishly, I find that it is more rewarding to help my fellow colleagues when I know that a patient is a better fit and I get to help my friend. And then I also get to help my patient get the results that they're looking for. So I think it's two-sided, but I do think the ego plays a big role. And sometimes it's
Yeah.
hard to ego.
And, I can get it because if I have somebody who knows me and they really want my help, and they're like, I know you, then that's fine. I'll do my best, but I will also try to collaborate the best I can. So we kind of have to do a little bit of both, but yeah, definitely working as a team is so much better. I am curious though, what inspired you to really have a passion for that specific demographic of people in that phase?
Um, so I always actually wanted to work in the pediatric population. So I think why I have like a collaborative mind is I kind of came up wanting to be a physical therapist, and that was a whole story in and of itself. But I'm a chiropractor that practices very similarly to a PT. But because of that, I wanted to work with peds, and I was talked out of it. And as I was in school, I was like, everybody's doing the sports performance like thing, and I wanted to because that's what I was told to do. And I was like, oh, everyone wants to do that. I don't want to do that. So I kind of had like a crisis, if you will, and started trying to think of different things. And I was like, well, pregnancy is kind of cool. This is fun. And my OBGYN was like, I love chiropractors for pregnancy. And I was like, oh, that's the first time I've heard a medical provider say something like that, which then sparked my interest. So I started kind of going down that rabbit hole of like learning as much as I could about pregnancy, postpartum. And then I was like, if I work with moms, families are bound to follow. So that's kind of how I ended up in that role. But the more I've like dug into that, the more I realized like the support. I don't have kids, but I like draw inspiration from my mom, knowing like what she went through and the challenges that she had through pregnancy and postpartum, and the lack of support. Even though that was like 30 years ago, she still will bring that up. Like, my doctor said this, and I didn't know that this was a thing. And I'm like, no, mom, like that's not how this works. So taking from what my mom has experienced, I don't want future people to have to go through that. So that is kind of why I've ended up where I did.
Yeah. And I love how like you had the interest in pediatrics as well, because as you mentioned before, you really want to work with mom and baby as a unit.
Mm-hmm.
Can you explain a little bit more of why that's so important and why you value that unit so much?
Yeah. So the feeding dyad, so mom and baby, is very regulated between the two of them. So as we know, like infants when they're first born don't have the ability to regulate themselves, and they rely on their providers for that. And if mom is really dysregulated, which is not shocking, she just went through labor and delivery and hormones, and now we're stressed because we have to keep a tiny human alive. That's really stressful on your nervous system, and that keeps you in this like really anxious state, and your baby's going to feel that. And when your baby feels that, then that's just going to make things keep going in that pattern. And vice versa. If your baby is struggling to eat or sleep, or they're just fussy, and all of the different things that are happening with an infant, that's going to stress mom out. And then it just is like you play off of each other. So if we can get both of them to regulate themselves well and move really well, that sets them up for really good success to work as a team for that for the entirety of their postpartum journey, but specifically that fourth trimester. They get to feed better. They get to enjoy their postpartum, their newborn, because that's the biggest piece that I've always heard is they're like, well, my baby doesn't latch. And now I have to go to like 5 different appointments multiple times a week. I don't get to be with my baby. So having them work really well together in that phase sets them up for good success. And it helps mom recover, so she's not stressed bouncing from like 500 different appointments.
The level of appointments that you have for baby right off the bat is ridiculous. And in my experience, I didn't do lactation consulting, like I didn't do all of the other ones that a lot of moms really need help with as well. So I kind of got lucky on that point. But yeah, the care for the baby, it's all baby centric. So I love that this can be a unit, they're a team. And I almost view them as like, when you don't jive with someone or you can like feel their nervous energy, it's almost like two tuning forks vibrating at the wrong frequency. And it's just like,
it grates on your nerves. Yeah.
Yes. So if you and your baby are in sync and kind of in the same frequency, you're both being taken care of, like everything can regulate better. And then tell me a little bit about how you deliver care, because that is also a bonus on how you manage their treatments.
Yeah. So I go in their home. I'm mobile. I think one, I've practiced in offices, and I think there's a ton of value to be in an office. But working with the postpartum, in particular, patient demographic, I have heard time and time again, as we were just talking about, the appointments. They go from the pediatrician to the chiropractor to the lactation consultant back to the pediatrician, and then mom has to go to the OBGYN. And so that's a lot, especially if baby is having issues with positioning and all of the other things that can happen. So in and out of a car seat is a lot. Getting a baby in and out of a car seat is a lot for a recovering mom. And then not to add the stress of getting out of the house. So by going to their house, that takes a big stressor of like getting out of the house, doing all of that off of them. But then it also allows me to tailor their care as best as possible to them and to their environment. So that way I'm not telling someone to go home and like pick up a barbell when they don't even know what a barbell is or have access to one, but they have access to a yoga ball because they were using that for their birth prep, and we can make that work. So just being able to really tailor in what they need is why I've decided to do that home visit style of care.
And then seeing them in their environment, I can see the value of that because, yeah, like you said, you can see what they have available to them, but then you can also identify like leaks in the pipe, essentially.
Yes.
If there's breakdowns of mental health, if there's breakdowns of supportive care, you know, it's pretty easy to be able to see that, feel that, identify it, you know, and then you can also, if there's a partner involved, kind of include the partner and talk to them if they're there. So then it's more eyes. And then especially mental health screening. You mentioned how you really like collaborating with mental health providers, and I do as well, like the importance of that postpartum to have a second set of eyes. It would have been so nice because I myself didn't know that I was struggling, and had somebody come in, they would have been like, actually, some of these things that you're experiencing are postpartum depression, anxiety, you know, those sorts of things. And I didn't quite acknowledge it, you know, and had there been somebody else being there to see it. And I was just like, well, it's the middle of COVID. It's all the lockdowns. Like, this is just new baby. And it would have been so nice.
Yeah. I've told, I can't tell you how many people that it's easier to get in to see me than it is to get in to see like your OBGYN or your primary care on the majority of the time. And typically I'm going to be seeing you a little bit more frequently than what your OB or your midwife will be seeing you. So I think it's really important for me to have an idea of like how to keep an eye on the mental health aspect of things, and then have like a quick referral and support system in place. So that we can keep them doing what they need to do. Because it plays such a big role, and it can affect you for more than just the first 3 months after you have a baby. I've seen people diagnosed with postpartum depression 3 years postpartum after their last baby, because it can last for that long.
Yeah, 100%. I almost felt like I was in this like adrenaline rush, like of a high for like the 3 months postpartum. It didn't feel that hard getting up. I would be like awake and I was like doing things, but then almost once the level of like attention and care of the postpartum period like started to decline was when I really needed the support, because then I just felt like I was in it. I was in the trenches, whereas it was so fresh and new, a new baby. I still had energy from previous sleeps, you know, but then those sleeps catch up to you. So 100%. And then that's why I love how you deliver care in home as well as support virtually, from what I gather. Tell me a little bit about that.
So very similarly to how you do things, where you have a virtual support. Again, it's mostly how I deliver like their rehab exercises to do at home. They have an app. And then they have access to me. I hate saying 24/7, but they have the ability to reach out to me whenever they need me. And then I get back to them as quickly as possible. And the goal is to keep them off of Google, because the late night Googling of things is something fun to deal with and to navigate, because that ends up spiraling them, and rightfully so. Like your baby makes a weird noise or you feel a weird thing in your stomach that you're like, that's not normal. And then you go Google, and then next thing I know, we're like ready to go to the pediatrician or the OBGYN thinking we're catastrophic things are happening. And I'm like, nope, it's okay. That was just a postpartum uterine contraction or something so minor, but you would never know. So I like having the ability to have them reach out, to interact, and keep them as much off of Google, or have a quick fact check of what they read on Google. So that asynchronous support between in-person appointments has been very beneficial.
Yeah, I love that. And I also offer 24/7. Like obviously they can text at any hour of the day, but I will get back to them as soon as possible.
Right.
Not at 12 at night, you know what I mean? Like reasonable expectations there. But yeah, it's definitely setting them up for future success. It's helping them with it's not just a quick fix. This is a longevity sort of programming. And then like you mentioned, you are seeing them, you are talking with them, you are interacting with them so much more than the physician. And it's invaluable. Like people don't quite grasp how invaluable that is, to have somebody as a resource when they need, as opposed to, well, I'm experiencing this one thing and it's, concerning me. Let me call my doctor, and they're like, make an appointment. And then that's like a few days or a week that I can get in. And then by then you're just like, I've spiraled down the Google abyss. So the damage has kind of already been done. But to be able to have somebody to be like, okay, let's workshop this. Well, actually, it sounds like blank, something that's relatively normal to be expected. If it migrates into this realm, then yes, please seek medical help. You know what I mean? Like, and that can be so comforting. Like I've had pregnant clients who have messaged me different sensations they're experiencing during an exercise, and we've talked through it. But had they not had that, they would have been, I'm not moving. I'm not doing anything. This really hurts. I feel uncomfortable. I'm done, when really that could do more harm than good in the long run, because pregnancy, postpartum, it's such a whole body experience that by the end of it, you really can be quite deconditioned physically, health-wise, like all of these things, like strength. It's huge. And if you are told to not do anything, not lift, not do the appropriate movements, in my opinion, it can be more damaging than good. And this is obviously like a non-complicated pregnancy,
right.
You know what I mean? Like we're not talking everybody, right? Okay.
Yeah. Right. Like let's asterisk that. We need to make sure that it's the low risk, uncomplicated pregnancy.
Yeah.
But I mean, I have a patient right now who is a relatively fit person. I mean, they're not like a crazy active working out every single day, but and they're in their postpartum phase and relearning how to engage their core. She's been like, I didn't realize how hard that was. She was like, it was second nature, and now I can't. And I'm like, it's the whole process. So, like, as simple as breathing is hard. Right. And she was like, I never knew, had no clue. So it's always interesting to see how like people can reconnect to their body and relearn their body awareness, and because they don't appreciate it when they have it. So they relearning it is a whole fun experience.
Right. And a lot of women I've talked to during pregnancy, they've kept going. They've been strong. They've been doing the gym, and then they have postpartum and they're like, I feel so weak. Like I can't do what I was doing even just like 2 weeks ago. The baby's out. Like, shouldn't I be like stronger now? And I'm like, no, no.
Do you hear people that say they feel empty? I think we might have talked about this.
Empty. I don't know, use those words, but yeah, like there's just a void, a gap. Yeah. There's like, you used to have pressure that you could just have built in, baby was there, like all of the fluids and stuff. And then the muscles were being really stretched. So like you were dealing with pressure in the belly, and now with everything gone, it's just like
all loosey goosey.
Loosey goosey. Yeah. So that's very weird and hard to connect with. And in some of the pelvic floor clients that I deal with, like with an internal pelvic floor examination, I'm able to feel what their pelvic floor is doing when they breathe. And sometimes it does nothing. Like,
like pillow.
it's just like quiet, or sometimes it's just like so tense and tight and they're not able to move it or contract it. They have no awareness of their pelvic floor.
Right.
And this could be years postpartum, all just because of this event, this disconnect, and they're active, but they're struggling and they're like, why? And I'm like, because you're missing this like coordination effort. And no one's ever taught you and told you that it needed to be dealt with. So
Yeah, that's where I like the pelvic floor PT, because I don't do internal work. So I can teach them how to like do diaphragmatic breathing and help them like reconnect to feeling their pelvic floor like lower and rise up. But I don't get the opportunity. I don't want the opportunity
it's not really an opportunity
to do an internal exam to see what is happening in that regard. But I do have a way. I have taught patients how to externally feel their pelvic floor to get a basic idea of like what your pelvic floor is doing if with a breath, and then we can work from that. And if something doesn't resolve as quickly as I was hoping, then that's when I'm like, go see someone else.
Yeah, there's a lot that you can do with just external palpation, cueing, sitting on a towel and breathing into it. Like there's so many different ways to do that. So did I lose you?
It really kicked me off. I don't know what just happened.
Oh, okay.
Let's do the little spaz moment.
Yeah, that's okay. We can cut it off. And then it says like remaining time. And then it's like not counting down. So I thought that was weird, but we can finish up here pretty quickly. Okay, so if I could just ask you one kind of final question here. What is one thing that you wish every mom knew about their postpartum body or their body postpartum? Like what would you like them to know?
I wish they knew to give themselves grace, because your body is not going to look the same, and that it's going to change and things are going to feel different. And it's okay. It's okay to feel these feelings and go through these changes, and that we're not in a rush to get back to your pre-pregnancy self. And I wish they knew that we can get you back nice and strong and doing the things that you want to do, even if you didn't think you could do them before.
Perfect. Yeah. The level of fear that so many people have of like not bouncing back, not getting back to that, yes, there are changes. If you've had a C-section, there's, changes that happen if you had tearing. But more often than not, you can find the strength again, but there's no hurry. We want to regulate with the baby, spend time with baby, calm the nervous system. If you have a layer on top of that of hurry, you need to get back to like fighting form. Why? Right? This is not the season of life for you to frantically try to get back. Now, if you're like years postpartum and you've been in it and you're like, now is the time, and you're like really invigorated with a lot of support and it really is the time, then sure, there can be urgency with that. Not saying like it's never an urgent thing, but during this time, postpartum, it is really meant to be a team, like you, baby, partners, family, figure things out, because even if this isn't like your first kid, it's going to be hard. It's an adjustment. You've never had that many babies before in that specific circumstance. So lean on your resources, find that network that, other people can help you with, to be like, yes, I will accept help from a mental health provider, or an in-home chiropractor to help me with feedings and my body and baby's body. So I love it, and I'm here for all of it, basically.
Yay. Thank you.
So if any of the people that listen to this episode would really like to get in touch with you, tell me a little bit about the process of what that looks like. And I will definitely link anything in the show kind of transcript notes.
Yeah, you can, no one's asked me this before. You can find me on Instagram. It's underscore my first name, Olivia underscore Lynette. You can message me there. I also have a link to my calendar, so you can also book on that to set up a call to make sure that we are a good fit to work together, outline some goals and things like that. So that way we can really hit the ground running when we have our first in-person appointment.
Right. So, do you do calls like a little discovery type call? Is that something that you offer? Okay.
Yeah, but I do a discovery call so that way we get a chance to like, one, I get to interview you, but you also get to interview me to make sure that you like what I'm going to do. And then we see if I'm able to get you where you want to be, because there are instances where I am not the best fit for you. And then you'll learn about like the process and how that all works with us. And then we'll get you booked in for an initial appointment where we go through like the eval, the movement and all of that. And then we get you started on your treatment plan.
Okay. And then those treatment plans would generally be at least several weeks. So like having the expectation of like, we're going to commit to a plan of care to get you where you want to be, because this is not a one and done kind of thing. You know that, I know that, and hopefully we can convince everyone else to recognize this. But thank you so much, Olivia, for all of your expertise and the network you're building. And I'm glad to be a part of it. So thanks for sharing.
Thanks for having me.
Yeah, of course. And we will definitely talk soon.
Sounds good.